This case study uh, with a patient. She is a 55-year-old lady, presents with the excessive thirst since 4 days. She has bilateral knee pain and she has no other symptoms. Her height is 156 centimeter and the weight is 80 kg. Examination indicates a blood pressure of 120/80 millimeter mercury and the heart rate is 80 per minute. There are no other significant findings. So after diagnosing this one, they have taken a few tests also. In that one, fasting blood sugar, that is 142 milligram per deciliter, and postprandial plasma glucose level is 258 milligram per deciliter. Hemoglobin it's 8.1 percentage. So after getting the test, they have diagnosed that that lady is having a type 2 diabetes with obesity. Her body mass index is 32.87. So first, for this management, first they have given some diabetes awareness, and the physicians prescribed advised her for diet control, that is reduced refined carbohydrate intake and reduce oil intake, consume at least two servings of vegetables per day, and physical activity. Because of the increased blood sugar level, they have asked her to reduce all these things, such as carbohydrate intake, oil intake, and they have asked her to take at least two servings of vegetables per day, and they have advised her to do physical activity regularly, and walking 30 minutes per day for 5 days are equivalent. Actually, she has to walk a period of 30 minutes per day. In a week, she has to walk 30 minutes per day, so that the blood sugar level will be controlled. And they have asked her to do yoga or resistant exercise 2 days per week. At least she has to do yoga as well as resistant exercise 2 days per week. And the doctors have prescribed her the tablet metformin 500 milligram twice daily, and they have screened for diabetes and related complications. This patient has been recently diagnosed diabetes and obesity, and diet and exercise are given to reduce the weight. That will be the first step. So in order to control the diabetes, diet is the important factor, as well as she has to undergo exercise. She has to do some small exercise that will give a control in blood sugar level. And they have started with the metformin therapy. This metformin, it is a bigonide that is used for the treatment of diabetes mellitus, and this metformin therapy is indicated to control the blood sugar level. And as a diabetes is often diagnosed after a delay, routine screening for both microvascular complications as well as and cardiovascular complications should be started at the time of diagnosis itself. So if they are diagnosing this diabetes after a delay, so they have been asked for microvascular complications. They have to screened. There may be possible for cardiac problems. So they have to check screening of this microvascular complications and cardiovascular complications. So there is a possibility of heart attack and cardiac failure will occur for these kind of patients. So they that patient has been asked for screening of this microvascular complications as well as cardiovascular complications. That should be started at the time of diagnosis itself. Diabetes mellitus is otherwise known as hyperglycemia. Uh, this is developed nowadays for almost 75 percentage of the people suffered with this diabetes mellitus. So we have to give some specific preventive advice for this diabetes patients. So do not skip the meals and take the tablets even during illness. So you have to ask the diabetes patient that they have to take these medicines regularly, and if they are having some other illness also they have to take this medicine, and always take 15 to 40 gram of carbohydrate if the patient develops hypoglycemic symptoms. Okay, then so after taking the tablets, their blood sugar level will be reduced. So you have to tell the patient if they are having some hypoglycemic condition, they have to take 15 to 40 gram of carbohydrate, and you should ask the patient to take their meals regularly. And during severe illness, we have to check their blood glucose level constantly. And if there is any kind of vomiting or reduced intake for any reason for more than 12 hours, immediately we have to contact the